I think if you attack wrinkles, furrows with the Reliant repair device at this stage, when patients are 40 or 50, patients are never going to get the saggy skin that they used to get when they were 50 or 60.
What the Fraxel laser does is shrink your skin.
This computerized pattern generator will actually lay down myriads of tiny dots. And what happens is that each of those tiny dots is actually a column of vaporized tissue, which causes immediate contraction around each column, very rapid healing. Within a few hours, actually, those vaporized areas have healed up nicely.
But how does it differ from other laser treatments like the carbon dioxide laser?
That really fell out of favor because of the persistent redness and swelling and potential for scarring and pregnant problems. With this device, you simply don't get those problems at all.
Total downtime?
With this technique, you're in the physician's office. It takes about an hour. It's probably 2 or 3 or maybe 4 days downtime. You'll still have some redness and swelling afterwards. You can probably put some makeup on. But essentially, you're back to work within 5 or 6 days.
Dr. Nancy Snyderman joins us now. Hey, Nancy, good morning.
You winced.
Boring little tiny columns in your skin, and then those skin columns shrink up? Is that
but
it?
the column is 1/10 of the diameter of a hair follicle. That's how small it is.
But can they accurately control the contraction here? I mean, you're going to have some people who end up with that real facelift look on one side and not so much on the other.
That's why this is interesting, because you know that people hate that sort of pinched look where you can see your cheekbone and it looks like you have saran wrap on your face. This is really intended for the 40 to 50-year-old who doesn't have that really sagging skin yet. It's really a preemptive strike against the facelift.
Can you use it, though, for people who have more defined wrinkles and furrows, as he mentioned?
You can. You're not going to get the same result, I suspect, if you have a 65-year-old woman who already has really crepey skin versus a 45 or 50-year-old woman.
Crepey. Okay, good. We didn't mispronounce something there, did you?
No, that's a doctor term.
Okay, good.
Crepey skin.
And are you going to need to repeat this every 4 or 5 years?
You're probably going to have to do it every 5 to 10. It costs $3,000 to $5,000. It appears very safe. Laser technology has now been around for a long time and very vetted. This just came out, though, and FDA approved. It's being presented at the big dermatology meeting in San Antonio right now. This is going to be in your doctor's office soon. What will be interesting is to see how many dermatologists have that credit card to pay for this up front and how long it's going to take them to pay it off. This isn't cheap technology, but it works. All
right. Well, listen, it's interesting. I mean, and anything that keeps people away from the knife, I mean, that's major surgery.
You can say to people, this is a preemptive strike, and it's taking care of your skin, and you can avoid a real operation. There will be a lot of people, men and women, who will be interested.
And no side effects known at this point?
Redness for a few days, and that's it. Very safe.
Typical weekend.
Yeah, exactly. Get punched by the kids.
Yeah, Nancy, thanks very much. Good to see you. When we come back, the First Lady,